Good evening. Thank you everyone for joining us either in person or on TV. Thank you for being here and participating. Before we get started, I want to take the time to introduce some people to you. This is part of the team of experts who have been helping advise Nevada through this COVID-19 pandemic and who I have put great faith in for their expertise and knowledge in their individual areas. So first we have Major General Andra L. Berry of the Nevada National Guard. As you all know, the Nevada National Guard has been providing critical logistics support for our state. Their work is unmatched, and we're especially grateful for the work that the General and the Guard has done thus far and continues to do as we move along. Nevada's Chief Medical Officer, Dr. Hassan Azam, is here as well. Early on in the process, we formed a 5-member medical advisory team led by Dr. Azam. The work of our medical experts has guided many of the decisions we have made so far as a state. And if I can get everybody to raise their hands so everyone knows who we're talking about. Thank you. We're also joined by Richard Whitley, the state's Director of Department of Health and Human Services. His team has been instrumental in leading our efforts as we move forward and progress. Followed by Dr. Mark Pandori, who you folks have met in the previous press conference that we had. Director of Nevada State Public Health Lab is here as well. You heard from Dr. Pandori, as I said last week, about our efforts to create more capacity around testing in the state. He will continue as our testing expert throughout this crisis. I am pleased to have Melissa Peak Bullock, the state epidemiologist, here as well. Her knowledge and analysis of the distribution and patterns of this virus has been a major asset to the state and to me as we make decisions moving forward. Kyra Morgan is the state's biostatistician. She has taken the lead in looking at modeling throughout the country and analyzing where Nevada fits on those models and how those models should inform our actions. Dr. Christopher Lake joins us from the Nevada Hospital Association. The association has been a key partner in keeping state officials apprised of the situation on the front lines of fighting this virus. I also have with me State Superintendent of Public Instruction, Joan Ebert. We all know this has been a trying time for our schools and our families and our students, and today we'll provide an update on our plan to keep educating our students and supporting our families. And finally, Michael Brown, the Executive Director of the Governor's Office of Economic Development and Governor's Office of Economic Recovery, which is falling under Michael as we coming out of this pandemic. Michael has been instrumental in providing us with information. And everyone should know my Chief of Staff, Michelle White, to my immediate left, who is also joining us. There are many more team members working across the state to help provide input and expertise in various areas. As the governor of the state, I am grateful beyond words that we have the best and brightest advising us on our path as we move forward. And as I have said, I'm relying on our medical experts, on our scientific experts, on our statisticians, on our epidemiologists, as we continue to progress and move forward in understanding the disease and our response to it. I brought this team with me today because I want to update Nevadans on a very important topic. That is our planning framework to reopen the state and move forward in next phases. I want to begin with a situation report where we've been, where we are, and where we're going. First, Kyra Morgan, our state biostatistician, will provide some background on what some original models predicted would happen in Nevada.
Thank you, Governor. I'm Kyra Morgan. As he stated, I'm the Chief Biostatistician for the Department of Health and Human Services, and I'm just going to talk pretty broadly about some modeling efforts that are taking place and what these models mean for the state of Nevada. So we've been monitoring quite a few different models that are coming out of national agencies at the state level. And most of these are based on what we call an SEIR model, where that stands for susceptible, exposed but not infectious, infectious and recovered. And you might have heard about this R0 number that people talk about. These models are very largely dependent on an accurate estimate of R0. Loosely, R0 can be interpreted as the expected number of new infections created on average by a single infectious individual in a purely susceptible population. RT is another measure that we look at, and that is basically the same thing. It considers the length of time since the start of the pandemic. And so on this slide, I've attempted to depict that in some pretty simple terms that hopefully can illustrate how a decrease in the number of infected people is proportional to a decrease in person-to-person contact, appropriate PPE, and the ability to conduct contact tracing. The next slide shows, as the governor stated, some of the models we were referencing more early on in the pandemic. This is a graph of a specific model called the COVID Act Now model that was predicting some pretty potentially dire outcomes for Nevada, with peak hospitalizations and being very high and death tolls in the tens of thousands. The next slide is looking more at what we've done as a state to try to combat what the models were telling us might potentially happen. It's based on what we've implemented and our control measures that we see more positive outcomes happening than what these models were originally telling us. So this timeline just very simply starts with our first confirmed case of COVID-19 on March 5th, and then progressively shows some of the control measures that the governor's office has put in place, including closing K-12 schools on March 16th and non-essential business closure directives on March 20th, up until April 8th, where some directives were strengthened to close basketball courts, golf courses, etc. The next slide is segueing into where are we now. It's really important to understand that we have fewer cases and deaths than what was previously predicted by the models because current control measures are working. Right now, I should say as of this morning, Nevada had 3,937 confirmed cases cumulatively of COVID-19 and 163 deaths. Unfortunately, I'm certain that those numbers have gone up since they've been updated on this slide. All of the measures that we're monitoring do indicate that Nevada has started to reach a plateau. However, there's not sufficient data to indicate that we've actually started to see a significant decline in new cases. This graph also has a picture of the Los Alamos National Laboratory models that have been released at a state level, showing that there's an 82% chance that Nevada has reached our peak of daily new cases. But it's also important to understand that peaks related to hospitalizations and deaths are expected to lag behind this. And with that, I think I'll pass it back over.
Thank you, Kyra. I appreciate it, and I appreciate all the effort you put in and continue to provide to all of us. Now I'd like to turn it over to Dr. Chris Lake of the Nevada Hospital Association. Dr. Lake.
Thank you, Governor. The Nevada Hospital Association, we have been studying the infrastructure, the critical infrastructure of the hospital since this pandemic occurred. And we're really happy to let you know, Governor, that the all-cause hospitalization trends are decreasing and have been over the last 3 weeks, as well as the confirmed and suspected COVID-19 hospitalizations, which have been decreasing over the last 10 to 14 days. ICU all-cause occupancy is increasing slightly over the last week, but the COVID ICU occupancy rates have also been decreasing over the last 2 weeks. And our ventilator use, those trends are also decreasing with the COVID-19 patients, meaning that fewer people, even those in the hospital, are requiring that mechanical ventilator to get well. So with that, next slide, please. I'd just like to state that the hospital infrastructure, which is a critical infrastructure here in the state of Nevada, obviously, has plenty of capacity to handle anything at this point that comes our way in the next few days or weeks. The social distancing flattened that curve. It did exactly what we were hoping it would do, and that has saved a lot of that hospital capacity. And with that, I'll turn it back over to you. Thank you.
Thank you, Dr. Lake. It's very much appreciated. I'll now turn it over to Melissa Peak-Bullock, our state epidemiologist, and Kyra for the next slides. Go ahead, Melissa.
Thank you. I'd like to take a moment to talk about laboratory testing. Expanding our laboratory testing is really the key to understanding what the current situation is in Nevada. We have limited information.
It should have pushed that.
Excuse me. I will start over. Thank you. I'm Melissa Peak-Bullock, Nevada State Epidemiologist. I want to take a moment to talk about laboratory testing. Expanding our laboratory testing is really the key to understanding what the current situation in Nevada is. We have limited information available to characterize the spectrum of illness that is associated with COVID-19. There's no vaccine and no specific treatment. CDC clinical criteria for the consideration of testing has been evolving as the test supplies become more readily available. But despite our slow start, Nevada's testing capacity has increased tremendously since the start of the COVID-19 pandemic. And in response to this, the Nevada Department of Health and Human Services has released updated testing criteria to assist clinicians in their testing decisions. This testing criteria is a shift from only testing people who are severely ill and hospitalized, and also symptomatic healthcare workers, to testing anyone that presents with symptoms consistent with COVID-19. Testing expansion is absolutely essential in early identification of cases, the corresponding contact tracing, and our continued containment efforts. This next slide is just really talking about some historical context. And as I start, I'm going to look at some words from our history. And that is, learning history is easy, but learning its lessons seems almost impossibly difficult. And what we learned over 100 years ago during the influenza pandemic of 1918 is that social distancing measures are extremely effective, especially when human behavior is our only intervention. And again, we are currently battling an invisible enemy, and social distancing measures have helped to flatten our curve. And what we learned is that when social distancing measures are loosened too soon and without a layered approach, resurgence of the virus is imminent. This next slide is really a visualization to talk about the powers of social distancing. And you'll see on the first picture on the top, this is one person that's infected with COVID-19. This person has the potential in a 5-day period to go on to infect 2.5 additional people. Those 2.5 additional people also have the same ability to infect another 2.5 additional people, and so on. And what you would see is within 30 days, 406 people are infected with COVID-19. The bottom picture shows what would happen if we had even 50% less exposure due to social distancing. This first person would infect then 1.5 people with COVID-19. Those 1.5 people would go on to infect an additional 1.5 people, and so on. And in 30 days, you can see that would equate to about 15 people infected versus the 406 that the top picture is showing. And again, that's just with 50% less exposure due to social distancing.
Thanks, Melissa. So this slide is kind of going back to the models that I had referenced earlier. There's a couple different scenarios on the screen. The light dotted line is under the current assumptions being maintained. So the current mitigation being extended past May 1st, that indicates what we would expect to see. The dark dotted line, or the dark dotted curve, is the potential model that would have been our trajectory had we not imposed the control measures that we did put in place. And then the black solid line is potentially what could happen if we reduce those measures and increase the ability to move about more freely prematurely and not in that layered approach that Melissa talked about. It's really important also to understand that the models that we're using to identify likelihood that we've reached a peak assume continuation of current control measures. So those models will adjust quite a bit, just like we saw models early on adjust when we started seeing the effect of social distancing take place. We would expect that to move in the opposite direction. So if we raised certain control measures, we would expect models to start predicting worse outcomes again. To follow that up, the bottom line here, I guess, is that a second surge of cases would be likely if current control measures were lifted.
Thank you all for providing that situation report. And to summarize what you have heard from the previous speakers, and this is extremely important, the lower numbers of infected people and deaths, let me start over. The lower numbers of infected people and deaths than were previously predicted should not be seen as an indication that our actions were unnecessary, but as a strong indicator that our aggressive and control measures were both necessary and effective. One more time, the lower numbers of infected people and deaths than were predicted should not be seen as an indication that our actions were unnecessary, but rather as a strong indicator that our aggressive control measures were both necessary and effective. And your help and cooperation made that possible. As you just saw, the early model showed the potential for deaths in the tens of thousands if we didn't take immediate and aggressive action. But Nevadans took this seriously, and I'm proud of you. You've been staying home for Nevada. You're wearing face coverings and protecting your families. You are the reason we have avoided thousands of deaths and a breakdown of our healthcare system. You heeded the calls, followed the directives, and saved lives. Yes, you saved lives. The actions we are all taking going forward will determine if we continue with this success or if we take a more obstructive path. A lot of people have been sharing this analogy recently with me, and I think it's appropriate, arguing that flattening the curve and that we can immediately lift restrictions in one fell swoop is like arguing that a parachute has slowed our rate of descent so we can take it off now. We cannot take off the parachute. Experience gleaned from other countries teaches us that we cannot flip a light switch and turn our lives or our economy back on too quickly. We still have a responsibility to protect people and to protect our economy. Even though the models look good for Nevada right now, we are not out of the woods yet. The models change based on our behavior, based on your behavior. We're in a better spot than we were 6 weeks ago, and we've gotten much more data to help us move forward as we work on our plan to reopen the state's economy. You've heard me say this a lot over the past couple of weeks to the people of Nevada. The lives of Nevadans are more important than profit. That remains true today. But I also understand what the cost has been to our state, your families, your businesses, and our economy. We now want to move into a phase where saving lives and restarting our economy are not mutually exclusive. And our number one goal as we move forward towards is to ensure that Nevada's economic reopener is sustainable. We know the following to be true. The reopening of our economy is highly dependent upon testing, expanded testing and tracing capacity. Again, expanded testing and tracing capacity. Economic activity and recovery will require close collaboration between the state's employers, state and local governments to ensure that the gradual lifting of pandemic restrictions does not lead to an uncontrolled increase in COVID-19 cases. And because we are an international tourism mecca, we have an added responsibility to get this reopening plan correct. Our number one priority is always the health and safety of Nevadans, so we need to ensure that there are proper protocols and procedures in place to care for our residents and to welcome back tourists and visitors in a safe manner. I am proud of our hotel resort partners who have begun the thoughtful process planning to protect employees and visitors at their specific properties when they reopen. That is their number one priority, and I'm glad to see them taking proactive steps. And I know the Gaming Control Board, which will ultimately sign off on any casino reopening plan, is deeply involved in this work as well. This is going to take a big lift from all of us at every level and in every sector. As I said before, we could flip the switch and turn the lights back on, but our experts predict and experience elsewhere in the world shows us, if we don't do this in a controlled and informed manner, we'll be hit like a tidal wave in 2 or 3 weeks. And I won't do that to our state. I know other leaders don't want to do that for Nevada either. So here's the reality. We are seeing fewer cases and deaths than were predicted by many of the models early in the outbreak. That means social distancing and other measures are working, and they're working well. Flattening the curve is only beneficial if we keep the curve flat. And the factors that helped us flatten the curve, like staying home, practicing aggressive social distancing, and frequent hand washing, are still critical to our success. This virus isn't gone. We have flattened this curve because of our human behavior. The virus still remains and will remain until doctors and medical experts find an approved treatment and develop a vaccine. So the emergency is not over yet, but it has entered a new phase. We must continue to use good behavior and follow medical advice as we navigate this phase. Today, I wanted to get together with some of my team to present our planning framework for reopening Nevada. And I've been working on the state-specific framework for weeks and spent the last few days reviewing the White House's Opening Up America Again plan as well. From the start, we have worked to ensure that our state measures were in accordance with federal criteria and guidelines. Today's overview is not the full reopening plan. We know that our first step had to be setting strong criteria that we must check off before we begin phase one of the reopening. That is what I'd like to walk you through today. Once I present our framework and criteria for reopening, I'll give a quick overview of some things Nevada can expect once we enter phase one. In the coming weeks, my team and I will continue solidifying the details of phase one as we work with businesses and community leaders and elected officials throughout the state. This is our overall goal. We want to progressively open up different types of facilities and industries in a way that allows Nevadans to gradually return to their normal lives while continuing to prevent the spread of the disease. So once the curve is flattened, our goal is to keep it that way until we have validated, approved treatments, and a vaccine. The federal government has created gating criteria, or criteria that should be met before we can move on to phase one. Think about this as phase zero. This is what we should do before we can get to phase one. Again, I'm glad to have my experts with me today to talk about this framework and how we will measure this criteria to let us know when we have passed the requirements to enter into phase one. Kyra, slide one.
So the first criteria for reopening is a consistent and sustainable downward trajectory of COVID-19 cases and hospitalizations over a 14-day period, measured by a decrease in the trend of COVID-19 hospitalizations and a decline in the percentage of people testing positive.
The second is the healthcare and public health system should be able to adequately respond. Ability to maintain hospital capacity without the use of crisis standards of care, sufficient public health workforce capacity, local and state health departments to conduct contact tracing, detect, test, trace, and isolate. Expandability for healthcare providers to administer tests for symptomatic patients, and sufficient laboratory testing capacity to process COVID-19 testing samples.
Thank you. Before we move to phase one, we must have a sustained ability to protect our vulnerable populations. That means outbreaks need to be successfully contained in a special setting, like health facilities, assisted living, and skilled nursing homes. We know these populations are more susceptible to the virus. We must have the ability to converge on clusters in vulnerable populations and address them head-on to contain the spread. Framework 4. Once these items have been completed, we can move into the first phase to reopen, confident that we have all the necessary protective measures in place. Due to the criteria that was developed by the state team and in accordance with the White House guidance, as of right now, I cannot give you a firm date as to when we will meet all of this criteria to begin phase one reopening plans. If we continue on this path, the date is on the horizon. Our behavior as Nevadans will ultimately help determine this date. And my goal is that my team and I will be able to communicate that to the public with adequate notice so businesses and services throughout the state will have time to prepare. This is atypical. The reopening needs to be flexible because it's going to rely on data, and this is a virus. There's going to have some real-time decision-making if we see a spike in cases, and I update Nevadans along the way as we monitor our progress. I'm working to update my previous directives to reflect this new reality that phase one can only begin when this criteria has been met. Once we begin phase one, we will be able to loosen restrictions on certain activities and businesses, and the loosening of these restrictions will be done in accordance with federal guidance that's tailored to Nevada's specific industries, businesses, and communities. Now I want to walk you through a little bit of what phase one will look like. The state will be working with stakeholders, community leaders, and elected officials throughout Nevada on our phased-in approach to reopening. But today I wanted to walk through what we do know about phase one based on the federal criteria laid out in the Opening America Again plan. These are the initial standards Nevada should expect once all reopening criteria is met and we enter phase one. The federal government phase one recommendation starts with guidance for individuals. The federal criteria recommend that all vulnerable individuals should continue to shelter in place. Nevada's medical advisory team agrees with this recommendation, and so do I. When we reach phase one, we want to make sure that our vulnerable residents continue to stay at home, and those who live with vulnerable residents can take the necessary precautions. As we approach phase one, we'll make sure updated guidance is issued on this very topic. During phase one, all individuals should avoid socializing in groups of more than 10 where you cannot maintain appropriate social distancing. Again, our medical advisory team agrees with this recommendation, so we will maintain our directive when it comes to public gatherings through phase one. Next, guidelines from the White House recommend that individuals minimize non-essential travel. We agree. So the previously issued travel advisory in Nevada will stay in place through phase one. Finally, the White House recommends the public strongly consider using face coverings while in public. We have already issued guidance urging Nevadans to wear face coverings in public, and we are currently reviewing the possibility of strengthening this guidance as we begin to reopen. Employers. The second set of recommendations from the federal government refer to how employers should behave during phase one. Here's where we will tap into the expertise of Michael Brown, Executive Director of GOED, Governor's Office of Economic Development, or as I like to call it now, the Governor's Office of Economic Recovery. Consideration for industries of all types will be done in consultation with GOED. Director Brown and his team are going to focus on both the immediate recovery by helping to provide strategic reopening guidance to businesses on the protocols and practices required to operate under these new conditions. In the long term, GOED will help support businesses after reopening by working together to help design and pursue strong economic strategies. And most importantly, Director Brown and GOED will not be doing this alone. The director will be reaching out and conducting sector-specific discussions and planning sessions with leaders throughout the private sector and other state agencies and licensing boards. Finally, the phase one federal guidance has recommendations for specific types of employers. During phase one, in-person visits to senior living facilities and hospitals will be prohibited to protect the health and safety of residents. But I strongly encourage these facilities to consider video conferencing capabilities. Under the federal criteria, bars should remain closed. The Nevada Medical Advisory Team agrees, and so do I. So bars will continue to operate under existing restrictions during phase one. The federal criteria also speaks to other specific employers, including elective surgeries, gyms, and other large venues like restaurants, movies, places of worship, and sporting events. Excuse me. All of these places are under review by the Nevada Medical Advisory Team. Once they have made a recommendation on how to handle these places during phase one, we will issue guidance and work with these industries to reopen in a safe way. Finally, the last category in the White House's specific employers list is for phase one is schools. In alignment with the federal government criteria and after extensive discussions with Superintendent Ebert, I've made the difficult decision to continue educating our students through distance learning for the rest of this school year. We will continue our efforts to support teachers, staff, students, and families throughout the rest of this academic year, and I'm grateful to Superintendent Ebert's ongoing leadership and in coordination with our superintendents to provide innovative resources for our students, educators, and families, as well as working through the very challenging issues, including graduations for our seniors. I've invited Superintendent Ebert to be here with us today to talk a little bit more about this step and what it means for Nevada students. Superintendent.
Thank you, Governor, and thank you for your leadership and support of all of our schools. I know these are very difficult times for our students, our families, as well as for our educators and our staff. I want to note that while our students will not be returning to school buildings, the school year is not yet over. This announcement encourages us to double down on our efforts, strengthening our delivery of distance education and promote equitable access to resources for all of our learners. We can all be proud of the ways our districts and schools have continued to serve our students, not only through distance education, but by also ensuring that our students have access to food services as well as the much-needed social and emotional support. Unfortunately, due to the COVID-19, the graduating class of 2020 will have to shift many of their celebrations and milestones that they have been looking forward to throughout their entire high school career. What we have done is put policies in place to ensure that students will be able to graduate on time, and we trust our local leaders to find creative ways to celebrate our students in a safe and appropriate manner. I want to note that Nevada has a long-standing tradition of local control of education, and as such, district and school leaders are empowered to make decisions regarding the content of distance education, regarding the curriculum, and the grades. Parents and families should contact their child's school if they have questions or concerns related to school building closures and/or distance education. Our local leaders are the best positioned people that can provide the up-to-date and accurate information to address each student's unique needs. The way forward may be clouded with uncertainty, but this much is clear. Rising to the occasion will take a whole society effort. I am proud of the innovative work going on across our state, and I look forward to continuing to collaborate with our administrators, our educators, staff, and families to develop thoughtful processes and plans. We will work together to support our students through the end of this school year, and then we can begin planning for a smooth transition back to our classrooms when the time comes. Thank you.
Thank you, Superintendent Ebert. We appreciate it. So, this is the start of our plan. Based on the guidance of our Nevada experts and the federal government criteria, we will focus on making sure we are prepared for phase one. Once our reopening criteria are satisfied, and only then will we move into phase one as laid out by the federal government. While we monitor this criteria to be able to move into phase one, we will be preparing and issuing guidance to further spell out how phase one works, the phase one implementation. The team of experts you see around me will also be reviewing phase two and phase three criteria as set out by the federal government to see how that criteria fits with our national Nevada-specific plan. As I mentioned before, the Governor's Office of Economic Development, led by Director Brown, along with our local public and private partners, will begin sector-specific discussions on reopening plans. Nevada will also continue coordination with some of our fellow Western states. We're in close conversations now to share challenges, solutions, and best practices, and I look forward to strengthening that partnership in the very near future. Thank you for your time, and now we will take some questions from the media.
For those who are on the phone, if you can continue to hold, we'll take a question in person from Carson City first. Thank you.
Hi, Governor.
I'm sure.
Do you expect to be showing people in a dashboard or a graph where we are at any given time on this plateau or this downward slope and when we can expect we'll be reopening?
Well, we're working on that with my experts here in terms of determining where you are on the 14-day thing. You don't know until you're partway into it and how it stands, and then even you go into it, you can come back out of it. So we will be working to provide graphic material as we move forward and to be as transparent as we can with that.
Is the first we're going to hear about that going to be in a press conference or on a dashboard?
Jill, do you want to do it on a, you can do it either way.
We can guarantee you that the first time you hear about it will be from the governor. and his team. And it will be, we don't know at this time if it'll be a press conference, if it'll be on social media, or if it'll be on a dashboard. But you'll hear it from the governor in his office.
We'll make it available as soon as we have it.
Thank you. We'll now go to one of the folks who's on the call line. So we'll actually go to Michelle Price from the Associated Press. Michelle, if you could unmute yourself and ask your question. And we'll give her just a second.
Michelle, are you there?
Michelle, are you there to ask your question? We can move on to someone else if you need a minute to get ready. Okay, let's try Vanessa Murphy from Channel 8.
Hi, this is Vanessa Murphy from Channel 8. If you can hear me, everybody that can hear.
I hear you. Yes.
Okay, I'm just gonna go ahead and ask the question. Hopefully you can hear me. Businesses possibly reopening, some of them in that phase one, and schools remaining closed, childcare is an issue for many parents. Any solution to that?
I know that Superintendent Ebert is working with the various school districts. Child care and nutrition for our students is extremely important, and we'll continue to work with them all as we have thus far along the way.
Thank you, Vanessa. We'll go back to a question in the room here in Carson City.
Hey, Governor.
Hey, James.
You gave a couple examples of businesses that might be able to reopen during phase one of the plan. Can you give us a sense of businesses that might be folded into phase two, phase three, phase four?
Well, we're going to rely on Director Brown and the Governor's Office of Economic Recovery as we move forward. These are going to be small baby steps as we begin and see how it works. Hopefully, as people continue to practice what we've asked them to do, the social distancing, wearing face coverings, we'll be able to open up more of them and expand that, but I don't have specific businesses that I want to delineate at this time.
You guys are focused on phase one at this point, it sounds
We
like.
sure are. Yep.
Thank you. We'll go back to the phone line, and I will repeat the question because I know folks on the live stream are having trouble hearing the questions coming from the line. So John Sadler from the Las Vegas Sun, if you're there, you can ask your question, and then I'll repeat it for the good of the folks on the live stream.
Hi, can you hear me?
Go ahead, we can hear you.
I'm just going to go ahead and ask my question on kind of a delay. I wanted to check in and see if there had been any discussions since the last press conference about any food earnings in Western states.
Sorry, John, we couldn't grab your question, so we'll come back to you. We'll take another question in Carson City, and we'll come back to you and try to hear your question again.
Governor, obviously you want to get this right the first time. Are there benchmarks? You open things, there's benchmarks. You have 14 days of decline. Are there benchmarks if something happens and the numbers start to rise?
Yeah, I am confident with the team that I've assembled here, both on the medical side and the science side and the statistician side. If we see an uptick in infection, if we see an uptick in hospitalizations or ICU hospitalizations, we're going to have to look at kind of ratcheting it back a little bit. Hopefully, we're going to adopt a very gradual approach and we won't see that, and we'll be able to have some control as we move forward. But as we loosen up the restrictions and start to open up, it's important that everyone understand if people don't continue to follow the social distancing and the regulations, directives have been set forward, we're going to have to tighten it back up because we'll see a spike in cases.
Thank you, and we'll go back to the phone lines. Jacqueline Schultz, Fox 5.
Good afternoon, Governor. The CEO of Wynn put out a very public statement on plans to reopen his casino and various casinos along the Strip by mid to late May. Have you spoken with Wynn's CEO and looked at the extensive plan, and in what ways do you and your experts for the state agree or disagree?
Well, I have spoken to Mr. Maddox numerous times in the last week. He sent me the plan late last week, I think, and I read it. He's proposing a plan for himself, not for the entire industry. I've spoken to other industry members, and any reopening plans would have to be approved and go through Chair Douglas Morgan of the Gaming Control Board, and she would have to approve on those, and we're gonna have to wait and see what they come forward with. But I can't speak to a specific plan that Mr. Maddox brought forward. But I do appreciate the thoughtfulness that he put into it.
Thank you, and we'll go back to the room in Carson City. Colton?
Hey, Governor.
Colton.
So earlier today, the SEIU 1107 down in Sunrise Hospital said it was there was an official there who said it was completely unacceptable that Nevada OSHA was investigating workplace safety complaints against hospitals without conducting worksite inspections. OSHA has said it's not conducting the inspections to protect its employees' health. Should OSHA be conducting worksite inspections before closing the complaints against hospitals?
Well, you know, OSHA's responsibility is occupational safety and health, and they're doing that. I know that they're like every other resource and department I have, stretched especially thin right now. When it comes to workplace and worker safety, that's extremely important to us, and if SEIU brought it up, we'll make sure that they look into their complaint, but I haven't seen it.
Do you think that they should be fulfilling these investigations by completing these workplace inspections at this point, if they're not doing it already?
Well, I think that OSHA does complete the workplace inspections, and if they haven't completed one, we'll check with OSHA and see exactly what went on, but I don't know the specifics about the complaint that they lodged.
Thank you. We'll try to go back to the phone lines here. Max Darrow from 13 Action News. Max, if you're on the line.
Yeah, Max Darrow from News 3, actually, here in Las Vegas. Governor Sisolak, what could you tell the small business owners who are incurring more and more financial losses with every day that goes by, who just say a tentative target date will help them recalibrate their businesses?
Well, I want to tell the small businesses that are out there the same things that I want to tell the families out there and the students and the teachers and all the workers, that your livelihood is extremely important to us. But when I look at the charts every day and I see the number of positive cases we have and the number of deaths that we have, it's a balancing act that we have to do moving forward. We're doing everything we can to open up the economy as quickly as possible, but I will only do that when we meet the criteria set forth for gating and moving into phase one. It's important that we save as many lives as possible and also protect those businesses, and that's what we intend to do.
And if I could ask just one follow-up, Clark County leaders today said we only get one chance to do this right. Are you on the same page?
Absolutely. We get one chance, and while it might not be a steady one chance in terms of opening, we might have to ratchet up and ratchet down a little bit. We have one chance to get this right. The health and safety of Nevadans is our #1 priority. Nevada will rebound, our economy will rebound, and we'll be there to assist the rebound. But before we do that, we have to keep our citizens and every Nevadan safe.
Thank you. We'll come back to the room here in Carson City.
Governor, there's probably always going to be some sort of a limitation on testing, but in your mind, what is going to be enough testing to make you feel comfortable to start phase one?
I don't have a number, exactly, more than what we have right now. I don't know how much more, if I can continue to see an uptick in the volume of testing that we're doing and expanded testing on Horizon, that would be significant for me, but I don't have exactly a number. We've got the front-end providers in our hospitals and medical professionals that are doing the testing on the front end, is getting the labs. We have lab capacity that we can do more tests, and I'm encouraging them to do that. So it's one of those we're gonna know when we get there.
Your framework talks about testing symptomatic patients, but is the goal at some point to be able to have enough capacity to test asymptomatic?
Well, in an ideal world, that'd be great. But I want to do more tracing. You know, when you get a symptomatic patient, you get a positive, we want to do tracing and test those folks and test people that are coming in that think that they might have been exposed or they're not feeling well, so that we could test, just expand the universe of folks that we're testing, and I think everyone would benefit from that.
Do you have a plan for getting those contract tracers on board, or is there going to be a grant or something?
Well, we've always had contract tracing. I mean, the health department has done that, just not to the extent that we're going to need to do it now. We're working with the federal government to give us more flexibility in the funds that are coming from the federal government to use it, the money that they're allocating for testing, that we could use that for tracing as well, and hopefully that the White House will accept the governor's proposal.
Thank you, and we'll go back to the phone lines. We're going to try Michelle Price from the Associated Press again.
Governor, I hope you can hear me this time. I'm wondering what we need for a full reopening to get back to normal. Is short of a vaccine, is there any situation where Nevada gets back to the way it was? And I'm wondering how, if other states nearby start reopening, how we're going to track those visitors if they start coming into the state.
I think I understood the question. You kind of broke in and out there. What we need to get there, it's going to be a gradual process. You don't run a marathon the first time out. You've got to start and proceed slowly. We're going to go in phases. We're not at phase 1 yet. Hopefully we will be at phase 1 soon. And once we're at phase 1 and we continue to see progress without spikes in cases or ICU usage, or we don't have a surge that I lose capacity in our hospitals, we'll be able to move on to phase 2. But I don't want to give phase 2 and 3 much thought when we're working on phase 1 right now. That's what we need to focus on, and how quickly we will get out of the gating period or phase 0 into phase 1, and then into phase 2 is going to depend on how well Nevadans continue to perform as well as they have. And I'm really proud. They've done a great job with social distancing. They've done a great job with hygiene and wearing face coverings, and hopefully that'll continue and we'll be able to move through these phases one right after the other.
Thank you, and we have time for a few more questions. We'll go back to the room in Carson City.
Governor, the National Governors Association sent a letter to Congress and the White House today. Are you familiar with the letter?
I am.
So there's a lot of issues they're looking at: testing, money, infrastructure. Is there something in this letter that specifically relates to Nevada that you think is incredibly important that the White House and Congress should know?
Sure, testing, money, cooperations, all the things that you brought forward, they're all extremely important to us. The governors got together to decide what we wanted to ask the White House for. We're asking for, obviously, more testing and coordination with the federal government. We're asking for reimbursement at 100% as opposed to 75%. We're asking for more coordination in terms of supplies and PPEs and so forth, and we'll continue to all. The governors are pretty much all on the same page as it comes to the request.
Can I have a follow-up to that? Do you believe for the type of testing that is needed nationwide and here in Nevada, it would require a Marshall Plan type situation? And is this federal government capable of that?
Well, don't want to get into what the federal government's capable of and what they're doing. I can tell you that, we're instructed to, they kind of gave us testing to deal with on our own. We've got Dr. Pandori here. They've done an incredible job. I mean, increasing our capacity. And Renown and UMC in the South and some of our other, Dr. Lake with the Hospital Association. I mean, it's been amazing what they've done. But we need to do a lot more. We need to do a lot more and get those front-end providers prescribing more testing so we can get more accurate results and more results. And it's left up to the states. So would I love to get a bunch of federal help? Sure, but I'm not going to count on it right now. We're going to move forward with what we've got.
Okay, thank you.
Thank you. We're going to try John Sadler again at the Las Vegas Sun. Okay, John, we'll follow up with you online.
Hi, can you hear me a little better this time?
We've got you this time. Okay, go ahead, John.
Okay, great. Governor, I'm sorry if this has already been answered. I'm kind of on a delay here. Has there been any further thought to joining the Western States Pact?
Yeah, I'm in constant discussion. Those governors are all friends of mine. We deal with a lot of stuff, both in the DGA and the Western Governors Association, the National Governors Association. Our proximity, we've all got really good relationships and communicate very, very frequently, and you'll be hearing more about that as we get a little later into the week. But those are good friends, and they've got great plans, and I support what they're doing.
Thank you. We'll come back to the room here in Carson City.
I know you said you can't provide a date for this specifically, but generally speaking, are we talking months before we get to phase 1, weeks, several months down the line? Can you give any time frame as to when we might see this?
It's going to depend on the people you see sitting in this room here with me. And more important than just the people sitting in the room here with me is going to be the 3 million plus people that are sitting outside of these walls that are Nevadans that have to do what they can to help us. And when you see people wearing face coverings and you see them with social distancing, it's really encouraging. But then you see things come up and people are standing in big groups and not have any face coverings on, and it sets us back. And it's going to depend. You take 2 steps forward and then 1 back, and then 1 forward and 2 back. So we're going to have to, the Nevadans cooperating and being as great as they've been. And I mean, I am lucky compared to what I've seen in some other states. We're all lucky that Nevadans have signed on and agreed to help us here. And a good friend of mine sent me a text that said, if we open up on May 1st or June 1st or July 1st, a year from now, you're not going to remember what date we opened up on. but you're sure the heck gonna remember if a loved one died as a result of COVID-19. And that's what I consider.
I have a follow-up for Ms. Morgan. Based on the current modeling that we're seeing and kind of this plateauing like you had mentioned, is there any indication that, or is there an indication as to when we might start seeing that, some sort of a steady decline in cases?
So based on the numbers now, we have just recently started to see data to substantiate a plateau. It took us quite a while of daily monitoring to even be comfortable to say that, because you never know if that's an artifact of testing capacity and other things that are happening. We are fairly confident that we are at that plateau, but it's important to understand, I think when we talk about the models and the peak, it's important to know that the peak isn't necessarily a day. The peak can last for an amount of time that is ill-defined right now. We do not see significant growth day over day in our new cases, whether that's attributable to lab testing capacity or other things. I don't feel that I can answer that at this time, but again, as the governor said, based on the behaviors that we're seeing, the way that we're going, it's looking to be positive.
Gotcha. And in terms of what constitutes a decline in cases, is that a consistent trend of decline of new cases, or is that where we stop seeing new cases and we start seeing more recoveries?
That's a pretty complex question. So we're looking not only at declining new cases, in a lot of our models, that's how they're determining peak. So a lot of models are saying we've reached the peak, and they're talking specifically to new cases. But more importantly, as the governor mentioned, we're looking at hospitalizations, we're looking at level of severity of these cases, what level of care do they need once they're hospitalized. It's not a single metric, it's an array of metrics that we need to look in combination with each other in order to take into effect testing capacity, hospital capacity, all of the things that are gonna allow Nevada to respond adequately.
Colton, flattening the curve allows the medical facilities to maintain capacity so that a surge wouldn't put us over and we don't have enough hospital beds, or we're short of ventilators, or we're short of ICU beds. And Dr. Lake's done a great job making sure that we have capacity left. And if there was a surge, we could handle it. And that's extremely important, and that factors into those statistics.
Thank you.
Thanks.
We'll take one more on the phone and one more in the room. So the last folks on the phone, KTVN Channel 2 News. We'll give you a couple more seconds. We'll take the question in the room first, and then we'll come back to one last phone line.
Governor, I wonder if you could give a little more detail on what it would look like to reopen some gyms and restaurants during phase one. Are we talking about 6-foot separation?
Hi, Governor. Sorry, I'm on a bit of a delay, but
Okay.
Excuse me, we're going to pause the phone line for a second for the question from the room.
Okay. I apologize. Was the question, how can you reopen in phase one gyms and restaurants?
Yeah, what would it look like? Treadmills 6 feet apart from each other?
I don't think you can reopen restaurants. I mean, restaurants are continuing to do their takeout and their curbside pickup. But you go sit down at a table, you're gonna have closer interaction. Now, if we could do social distancing in the restaurants in terms of, greatly reducing the capacity, that's something Director Brown is gonna be meeting with all the various industries, the Restaurant Association, and determine what their plan is, if it's practical for them to open up at, say, 25 or 30% of capacity. I don't even know if that's practical. Or if they'd rather wait till they could at least have 50% of capacity. Same is true with gyms. I mean, if you've got 20 treadmills lined up, maybe you could cut out every second or third one. I don't know. But that's what I've got. I've known Michael a long time, and I've got a lot of confidence in Director Brown, and he's going to be meeting with industry experts, with the citizenry, with everybody to get this input so we're sure we do it right. So we're sure we include who we possibly can.
And you've already had some of those conversations, or you're looking forward to those in the future with business owners?
I have numerous conversations every day with business leaders, labor leaders, political leaders across the country, and I'm sure Director Brown has the same thing, and we take in all that information, and we will provide it to you as we come up with a list ready to move into phase one and what we can deal with.
Thank you, and we'll try to go back to the phone line. I'm sorry about that. I don't think we gave you quite enough time to unmute your microphone. So KTVN Channel 2 News. Okay, we'll go to Brianna Erickson from the Review Journal for the last question.
Hi, Governor. Hey, yeah, sorry about that. So my question, I'm going to pivot towards unemployment. We were told that they were told that the state is in a deficit and doesn't have any money for unemployment claims. So just wondering if you could speak to that.
So we'll take the question about unemployment, Governor, an update on where unemployment's at and the money for unemployment claims, and then we'll come back to Brianna because they did call on Brianna there. Sorry about that, folks.
Okay, unemployment, we have, as we said in our previous press conference, we've went from 70 to 200, added another 100. Unemployment has reset the password online feature so that individuals can reset their own password, which should save time. We are getting to as many people as we possibly can. I totally understand the frustration. I can assure you, in talking to governors across the country, and I've spoken to, I don't know, dozen and a half in the last 2-3 days, every state has experienced this exact same problem. No system was set up to handle this kind of a surge. That's not an excuse. That's simply the way it is. We will get to everybody as quickly as we can, but we will get to them. And again, I want to reassure everyone that everything will be retroactive to the date you were eligible, so that we'll get all the money.
Okay, and I'm sorry about that last question, Brianna Erickson, Las Vegas Review Journal.
Thank you. Hi, Governor. There has been a significant spike this week in cases in skilled nursing homes and assisted living facilities in our state. What steps are being taken to prevent some of the disasters that we've seen in other states, in nursing homes in other states?
Great question. General Berry.
Thank you for the question. One of the things that we're doing is the National Guard has worked with Nevada Department of Health to start going and looking at the nursing homes and going with the investigators and kind of doing a spot checks to make sure that they're clean, that they're healthy, and in the event that we would see a cluster, we have the ability to send teams in to help eradicate that.
So if the little malfunction there didn't get you, the National Guard is going in to work with our nursing homes, make sure that they are clean, that they have adequate PPE, and that they've got sufficient staff on hand. And we appreciate, General, you and the entire National Guard being here. Those are Nevadans that are going up above and beyond, so thank you. Go ahead, Michelle. You're edging up there.
So can we say anything about where essential services such as DEETR in-person offices and the DMV might be opening? Do you envision that being part of phase one?
I will leave those specifics to this team as we get into that. We're not ready to go to phase one yet. And I don't want to be premature in saying what we can do in phase one or phase two or phase three for that matter. As we approach the ability to open up in phase one, you will be seeing the same group of folks that are here. You'll be seeing Director Brown a lot more and his consultation. Some businesses are more practical to open up with restrictions than others. You know that, depending on what the business is. And we're going to have those discussions. Every industry knows their industry better than I know it. And some have provided guidance and will continue to provide guidance. And we'll take that all under submission when we make the final determination. But you will be involved in those discussions and we'll make you aware of them.
And for parents who are wondering, is there a possibility that we would go into next school year and the schools would still be closed?
It is, let's see, April 21st right now. I cannot begin to imagine what we're going to be facing in August or September. Right now I'm worried about what I'm going to face for the next 6 hours of April 21st and on April 22nd and planning moving forward. But Superintendent Ebert might want to, there's nobody that cares. I thought I and my staff cared a lot about our students and our education until I met Superintendent Ebert. And Joan, if you want to say something, I mean.
So I have weekly calls with the superintendents themselves. We work with the medical professionals, and the health and safety, as the governor said over and over again. What's encouraging is that our school leaders are embracing distance learning and providing supports for families and teachers. It's a start, and we just need to double down on the work that's been already accomplished.
Thank you. I want to thank you all for being here. I appreciate you taking the time, but even more so, I want to thank this great group of experts and professionals and friends that I have here with me today that have been incredibly instrumental in determining where we're going, where we've been, and where we're going to go into the future. And Their advice is extremely important to me as we make these decisions, and I want Nevada to know when you hear various people talking about they heard this and their experts say this and that, the folks you're seeing here are some of the experts that I've got, and I'm telling you, I can vouch for them. They know what they're doing, they know what they're talking about, and they are truly experts in their field, and I will continue to rely upon them for the information we need to move forward. And with that, I think we're done, right? Thank you all very much.